Evandro de Azambuja from Jules Bordet.
This ESMO 2014 has been remarkable in terms of breast cancer. You heard the final results of the overall survival of the Cleopatra trial. It has a long time you didn't see such improvement in overall survival, nearly 16 months when you give pertuzumab, trastuzumab, and chemotherapy for patients with HER2-positive metastatic breast cancer, first-line treatment. This leads us towards the treatment, what is the new treatment in the adjuvant setting. In this combination of dual blockade with trastuzumab, pertuzumab, in addition to traditional chemotherapy, is being tested in the Affinity trial. The trial has fully recruited 4,800 patients, and the results are expected by 2016. If the results of dual blockade is confirmed in the adjuvant setting, this will be practice change again. It will be a similar benefit that you expected when we had trastuzumab in 2005. But also, there is another important trial that is being tested with trastuzumab chemotherapy, trastuzumab TDM1, which is trastuzumab linked to chemotherapy, and pertuzumab, or TDM1 plus placebo, in first-line metastatic breast cancer. And this will be presented next year. So, if these results are positive, perhaps this trastuzumab, pertuzumab will not be the first option, but perhaps TDM1 pertuzumab will be the first option. So perhaps next year you're going to hear new results that you change again the treatment of HER2-positive metastatic disease. And hopefully in 2016, the adjuvant setting will change with the dual blockade. What you also heard here in this meeting, we had a lot of discussion about liquid biopsies. Liquid biopsies is an interesting thing, it's being tested, it's not currently approved to be used in clinical practice, but there are several trials testing the possibility of avoiding biopsy of different organs, but testing the tumor response or risk of relapse in a blood test. And if this is proven in the clinical trials, this also allow a much more quality of life for our patients. So we do not need to submit them to serial biopsies like liver biopsies. Although the risk of a biopsy is very minimal, it has risks. And another important topic of this conference was the immune system. There are a lot of new research in this field looking for how you could boost the immune system of the patient to try to help the drugs to fight against cancer, not only breast cancer, but all other cancers. What will be new for 2015, unfortunately there was no discussion in this meeting, is about endocrine therapy. And now I'm talking about premenopausal patients with hormone receptor positive disease. Early this year at the ASCO meeting, there was a presentation of a combination of soft and text trial looking for aromatase inhibitors plus ovarian function suppression in premenopausal patients. And the results of the comparison, tamoxifen alone versus tamoxifen plus ovarian function suppression, will be presented now in 3 months' time. So this will clearly answer for us whether you have to give ovarian function suppression for premenopausal patients. And in terms of triple-negative disease, following what was presented in this meeting, the maintenance chemotherapy for the metastatic breast cancer patients, there is this same idea of prolonging chemotherapy, but using chemotherapy with a low dose maintenance, metronomic chemotherapy, I would say. After the standard chemotherapy, there is one trial, the IBSG 22 trial, that is going to be reported next year, and is looking for chemotherapy followed by metronomic chemotherapy, a small dose of a chemotherapy every day for a prolonged period of time. And this trial is expected next year. Thank you very much.
Thanks, Evandro.